So regarding the nerve gliding exercises for the upper limb, there are principally three nerves that supply the upper limbs, and these are the median nerve that supply the palm in the middle of the forearm, the radial nerve that supplies the radial border to the thumb, and the ulnar nerve which supplies the ulnar portion of the forearm into the little finger on that side as well. So depending on where your symptoms are for you, and also with the recommendation of the physiotherapist, select the appropriate nerve glider. But if in doubt, at least perform the median nerve glider, as this also covers most of the area of the nerves that we're going to be treating. So if you are to try and perform a nerve glider of the median nerve, it would be best to understand where exactly in relation the median nerve is to the rest of the nerves as well. So when we talk about the nerves of the upper limb, they all originate from the neck. Your neck is made up of a bony vertebra above and below, and between each section there will be a gap, which is what we call a foramen, and the nerve root will arise from that. So all three of the nerves will arise from the bottom part of the neck here, but the median nerve in particular will supply the front of the arm. So once it exits out of the neck, it comes to the shoulder, to the front of the arm, in towards the groove of the elbow, to the palm finally. So when you're thinking about it, think of it as one long piece of string from the neck down to the fingers, and it will allow you to understand what it is you're tensioning and what you're gliding. So in this position, if you want to start with the first exercise, you start, just going to turn the model around, with the elbow in about 90 degrees. Bend the wrist backwards and use your other hand to keep the wrist in that position. So you want to maintain that stretch there. Once you've done that, the actual movement is you're going to extend the elbow forward while maintaining that wrist stretch, hold for a couple of seconds and bend the elbow back. And you will just perform it at this speed and about 10 repetitions maximum. You should feel tensioning down the arm. You may even get some of the symptoms. If you get too many symptoms, of course, a reproduction of the pins and needles and so forth, you can ease off on the stretch on the wrist, or you can reduce the number of repetitions to about 5. But I would try to build up to 10. And after that, you can then, if you're getting symptoms on the other side, perform it on the other upper limb as well. Now, to perform the second stage of the median nerve glider, if you have started to progress this exercise, you can now change the arm position. This time you're going to take your arm out to the side about 30 degrees. Make sure you're looking forwards at all time. Turn your palm so it's facing away from you, and then you bend your wrist back. Now in that position you can see the interface you've stretched here and at the elbow, and it should be at a kind of a normal tension at the shoulder, okay? In this position, this is the starting position. You're then going to bend the wrist up towards the ceiling, so the palm is facing you, and then back down again. Again, only holding it for about a couple of seconds at this speed. So we've tensioned everything from up here and here, and we're gliding the nerve down at the wrist. Now what you can do is you can start to offload this a little bit more if you're finding this quite problematic. You can tilt your head towards the hand and perform the exercise. And as we said, this long piece of string going down the arm, you are offloading at the neck, and again 10 repetitions. If you've progressed with stage 1 and stage 2 and you started to find that your symptoms are starting to ease, you can then progress on to the third and final stage. In this position, you'd start with your arm out to about 90 degrees, palm facing upwards to start with. Bend your elbow, and then you want to bend your wrist back so that your palm is facing upwards. Imagine you're balancing a plate on your palm there, okay? This will be the starting position. Make sure you're looking forward. You then extend the elbow and bend the wrist so that the palm is facing you, and then return back to the original position. Again, hold it for about a couple of seconds. That's all it needs to be, because it's not a stretch. But be very aware that you're moving the wrist and the elbow at the same time. It doesn't matter about the coordination and the speed, as long as you're getting the movement. You may start to find you tiring because you're holding the arm out to the side, but persevere again to about 10 repetitions. If you're finding this quite difficult, what you can do again is tilt your head towards the arm. And again, if you think mechanically what's happening here, you've offloaded all the structures around the neck, and it might be a bit more easy to perform. 10 repetitions at that speed and just assess again. Okay, now when performing the radial nerve sliders, again, it is important to understand exactly where the nerve is in relation to the rest of the nerves in the upper limb. They come down the neck to the shoulder. When they get to the end of the shoulder now, they kind of diverge a little bit from the front and more towards the side of the arm, and it supplies the outer border of the forearm into the thumb and the index finger. So what this nerve enables you to do is to bend the wrist backwards, also to be able to what we call pronate the arm, to turn it, but also controls movement around the thumb as well. It tends to supply the sensation at the back of the hand as well. So the first stage of this is very similar to what we've already seen before. You would stand as you normally would, looking forward, have the arm out, down towards the side and relax to begin with. You would turn your palm inwards and bend your wrist up so that your palm is facing down and your fingers are pointing in towards you. That will be the starting position. Now then, the next position is you twist your arm and you bend the wrist so that it ends with the palm doing the opposite, facing upwards, but the fingers still pointing in towards you. And if you take it back again, now this may be a little bit confusing to you, those of you, but just remember, you start with the palm facing upwards and the fingers are always got to be pointing in towards you. And you should feel tension along what we call the radial border. If you're finding this difficult to do, you can offload the structures. Again, if you tilt your head towards the shoulder, you can offload the structures here. But again, 10 repetitions, holding it for just a couple of seconds. It's not a stretch, if you remember. And if it's just a little bit too difficult to do, you can offload at the neck as well. If you've been progressing well from stage 1 and you're finding the symptoms are starting to ease, you can then progress on to stage 2. Very similar position as before, standing with your arm out to the side. You start with your wrist bent back, fingers pointing out to the side and your palm facing downwards. I want you to imagine you're almost holding something in the palm here. You're going to turn and twist the arm inwards and bend the wrist upwards as if you're trying to pass something behind you. And then come back to that position again. So all the movements happening at the shoulder, elbow and the wrist at the same time. Twist the arm inwards and bend the wrist back as if someone can grab something behind you. What you can do is you can add the neck component to this at the same time. So you're trying to look behind what you're trying to pass towards someone behind you. And that is the movement. At that speed, holding for a couple of seconds, you may find that your forearm starts to shake a little bit. But perform at that speed, 10 repetitions, and again the same warnings. If you're finding it too difficult, ease off on the stretch or reduce the number of repetitions. Now when performing the ulnar nerve, it is again beneficial for you to understand exactly where this nerve is in relation to the other nerves as well. It arises similarly to the other two nerves from the lower part of the neck. But once it comes into the shoulder, instead of being at the front of the arm or off to the side now, it actually comes to the back of the shoulder and it supplies the inner border of the forearm and the elbow into the what we call the ulnar side of the wrist and forearm, into the little finger and some of the other fingers in the middle. It technically helps to bend and extend the wrist, but also helps with grip with your fingers as well. Now, if we're performing the first stage of the ulnar nerve slider, the position to start in is now having your arm out to about 90 degrees. Turn so the palm is face downwards, bend the elbow and bend the wrist back. Now take this position in for a little bit. Imagine you've got holding a plate completely flat there. This should be the starting position and you should find some tension along the ulnar border now. The shoulder and the elbow stay exactly as they are. All you need to do is move the wrist. So you bend the wrist upwards and back down again. Again, holding only in that position for a couple of seconds and just feeling that movement. It should feel like things are sliding and gliding around the ulnar side where you've tensioned. Perform this again 10 repetitions at most, a couple of times a day, and see if this starts to ease off the symptoms. Okay, you can progress from stage 1 of the ulnar nerve slider, you would have your arm in a similar position out to the side. You would again have your elbow bent with your forearm turned away, but this time you'd start with your wrist bent upwards so that your palm is facing away from you. This time you're going to be moving 2 joints at the same time, which is the elbow and the wrist. You simply extend your elbow and bend the wrist back so that your palm is facing away, and then bend the elbow and the wrist again, so you're always maintaining the palm facing away from you. You again hold these for a couple of seconds into position, and again 10 repetitions, a good couple of times a day, so about 2 or 3 times a day. And again, be sensible. If it is provoking the symptoms, stop or ease off for the number of repetitions. Or again, if you bend your head towards the arm there, you can put more slack on at the neck and it won't be as aggressive. And that concludes the video on upper limb gliders. I hope that you found that the video was beneficial for you. It was simple to follow the instructions and get you more familiar of how to perform the upper limb nerve gliders. But please do remember to still take into consideration the guidance that was given to you by your physiotherapist. And I hope that the video was useful for you, and thank you for watching.